Good morning. Dr. Shivnarayan Khandre is a clinical psychologist, NLP practitioner at Divine Life Counseling Clinic, Pune. He's also a certified hypnotist. Thank you so much for taking the time to speak to us today, sir. We are the students of Team IGEM MITWPU Bharat, and we are participating in the Internationally Genetically Engineered Machine and currently working on a biosensor designed to detect synthetic opioids non-invasively through saliva. We're particularly interested in how this kind of tool could support recovery, improve early detection, and bridge some of the current gaps faced by patients and counselors. We truly value your insights as someone deeply experienced in the psychological and behavioral aspects of addiction. Today, we'd love to hear your thoughts on what opioid addiction could look like in real life scenarios, the internal shifts addicts go through, and how a technology like ours can be made effective, empathetic, and useful in practice. With your experience in both clinical and community settings, your input will help us make this more than just a detection. It becomes something truly worth supporting. So, we want to know about the real life aspects of addictions. From your clinical experience, could you describe a real life scenario of someone struggling with opioid addiction? And what psychological or social patterns do you often observe during dependency or relapse?
First of all, thank you for inviting me here. And it's a wonderful thing to understand that you guys, the generation who is, we think that they are more into the addiction, in that you have become a icebreaker, that you're finding ways to people to get insight about the addiction and how we can understand the relapses and how we can intervene and prevent it. So first of all, heartiest congratulations, and it's a wonderful project what you're doing for that. Coming back to your question regarding opioids and the case, if we see the cases nowadays are increasing. It was there in Western culture, but now if you see the Indian ecosystem has also been too much engrossed in addictions like as we said opioids or any synthetic drugs or like other drugs. People, students, especially students or youngsters, are getting addicted to it in a large scale. And if we see that early intervention is very important for all these things. So I'll discuss one case what we have recently seen. There was a boy who is a he is studying in BTech only right now. So he had an addiction. He was a gym freak. He was a sport person. He was good in his academics. Everything was going good. One fine day, he had a injury, and where he was induced with medicines which contained synthetic drugs, which was a painkiller for him. After that, there were few issues what he was suffering through, the heartbreak in this age, which happens usually, then the other issues. So when he had that surgery and the medications it started for him, he felt like something is happening to me, something special is happening to me. That there was the emotions, there was pain, everything was numb after having the drugs, and he felt so comfortable. The overthinking, all the clutter was decluttered for him. So he was very fascinated. And as he was progressing in his physical issues, he didn't understand that he was getting dependent on the drugs. The doctor told him to just discontinue, but he just went on, and he felt that this is the way out for my emotional numbness, for my just from clutter to declutter. I want to stop my overthinking. So he was using that medicines as a support for his mental health as well as his emotional health. So slowly he became so addicted. After some days, he was not able to give up. Once he started giving it up, he started having withdrawals about it. Then he visited us. We had multiple sessions, and then we started some medications to just taper down his craving about it. And now he's doing fine. But there was a void of 1 year for him, which he was not able to focus on career, friends, family, social life, and it created a lot of disturbance for him. No, it's fine. It's fine. Don't take it.
What psychological or social patterns do you often observe during early dependency or relapse?
Okay. The first question. Okay. Okay. So I have shared this case. Okay. So in this case, what we understood that how is a social socialization was disturbed, his interpersonal relationship was disturbed, academics was disturbed. So it creates a lot of impact in a mind of a person when they get addicted to it, and it's like they are getting into it as a big challenge. But again, the relapse prevention is very important. So that time, giving them the right support about it is very important. But the main thing, if you see, in addiction, the main factor is that we call it acceptance or the denial stage. So it becomes very difficult for a person to admit that they are into addiction or they are not using it, it's abuse. So that's why relapses are very common in addiction. We call it a heartbreak usually. When you are treating an addiction patient, we know that there will be heartbreak someday, so we have to prepare ourselves. So relapse is a very common thing.
Okay. So, what's the addict's mindset like? What mental or emotional shifts are they facing, and how do we understand addiction distorts self-awareness and choices from a psychological point of view?
Okay. So it is a very wide topic if you see that way. But if you, as you have mentioned the word emotions, so if you see addiction starts with the phase of emotion, okay, or it is more of habitual, or it is a learned behavior. There are three phases here. If you see when there is a child or there is a young adult who is into the addiction, so he gives the most common three reasons are he's more inclined towards his friend circle. They have taught me, or to get him to fit into that community. He wants to do the addiction, or he wants to be cool, as we say. The second thing is it's more of emotions. The person with a lot of anxiety, fear, or like specific anxiety they have regarding exams, curriculum, career. So they more try to declutter themselves, just taper down their overthinking. They find the way out from this. So they use addictions or alcohol, cigarettes, then opioids. These are very common things they use. The anxious personalities are more addictive. Let it be emotions, let it be addiction. And if you see the third stage here, third phase, we call it like they are more into the susceptible manner to all these societal norms where they feel that if I have to fit in the society, I have to adhere to this ritualistic behavior with friends or any the group. If I have to fit in that, I have to be the part of that community. So I use the ways where it looks like a trend for them.
So, would you say the behavioral links from biological perspective, how would that play a role in this?
Yes. So what happens if you see addiction is not only meant for the drugs, synthetic drugs, it can be of any type. It can be of food, it can be of anything what you consume in excess amount, right? So what should be the idealistic thing? The standards what we set, right? First thing. Second thing, should I do it? Okay. The if you see the mindset of a addict or the person who is susceptible to addiction is first thing is he explore, he understand ये क्या है मुझे ये try करना है, I have to see about it. Once he get into it, he feels a high about it. There is a special kick. When we eat sweet, we feel very fascinated or feel very excited. So there is a kick where there what you can say dopamine pathways are hijacked, and it is called as a रिवॉर्ड गिविंग एलिमेंट उनको ऐसा लगता है कि कुछ स्पेशल हो रहा है उनके लाइफ में और उसके बाद वो व्हेन दे डू दैट आफ्टर दैट एवरीथिंग फील्स वेरी शैलो फॉर देम कि दिस इज द हाईएस्ट दिस इज द यूफोरिक स्टेट आफ्टर दैट इफ आई डू एनीथिंग इट इज लाइक समथिंग very negligible or very minuscule which gives me pleasure. Let it be food, let it be life, let it be traveling. So this is the highest thing. So it becomes an emotional dependency on that thing. Ki after doing a lot of things, enjoying things, going with friends, I'm not able to enjoy. So the best thing I do something which is more excited, more this thing. So I think addiction plays a role here that makes you feel very higher and higher. So we see that someone started with alcohol with 90 ml, he goes to 180 ml, he goes to 360. Why it happens? Because he's not able to satisfy himself. 180 के बाद his tolerance level increase. He goes into 300, 360. It increases. So it is more of emotion and dependency and it creates a lot of feeling of I need something high, 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 and it becomes a pattern for them.
So, what are some early symptoms that you notice and the symptoms that the patients or the people usually like go through?
The symptoms, if you see that way, the first symptom of an addict person, he is very restless. He is never calm. He'll be on the go. He wants to do all the things at a time. He'll just be restless. He'll be very clumsy. right? There will be a lot of emotional disturbances in him. He'll always feel anxious. He'll be very irritable. He'll be sitting in the room, but you can identify him that he is not okay. He's not doing well. His emotional health will be completely down. He'll just go on and go on and go on about things which are might be relevant to the system, or it might not be relevant. So it creates a lot of distortion, cognitive distortions in their mind and their behavior, and we can easily identify a person is addict.
And what are the 5 common symptoms that you think are the root cause, if you have to say? That is not coming for symptoms.
Symptoms, as in if we see the things which because of which they get dependent on this, or is it like more of the symptoms after the addiction?
The things also, and when they get used to these drugs, what are the things they face? Like you mentioned euphoria, but there are other things also.
Okay. So the basic thing when they get into the drugs, what they exactly feel is first thing there is numbness. Numbness in the sense they are not able to feel any emotions or people around them. They feel that everything is within me. They are so into that they are not able to enjoy anything around them. They are not able to feel the presence of anything around them. If their brother is coming, their sister is coming, parents are coming, a friend are coming, whom they are very close to, they are just numb around them. Second thing, their self-care. If you see, they become very unhygienic. They are not able to focus or do their routine, their daily chores. There is no time to sleep. There is no time to wake. They are always in their own shell where they are performing activities which are not okay or not good to their health. Their appetites, their sleep patterns are very disturbed. They are more rebellious, more rageful. They become very irritable, and they try to just what you can say, do such things which are not acceptable to their personal and their societal norms.
So, if we ask, what are the limitations do you now see in emergency or rehab settings? What might be a probable point of care that could be helpful for such scenarios? Yes. So first thing, as we said that first prevention is very important, or I'll say the identification part is very important. When there is a person who is having addiction, if you see, if you now we are dealing in addiction from like 70 years, and the most common thing what we face is denial. When the patient comes, sir, I didn't have anything. There was nothing. They are lying. So first thing, denial. And when we try to do the test, we find a lot of discrepancies there. There are a lot of drug abuse. He'll say that I have just taken this, but there will be multiple drugs. There will be multiple additions he might have done. So for that, the main thing is intervention is very important. You have to identify the main lag here, or I'll say the fallback here is that our system, what the test we use right now, is something which gives us a very delayed report. Like it takes 5 to 10 days on an average if you do something for opioids. And the second thing, it happens to blood test or urine sample where I get the client or the patient is not comfortable with, or they are more rigid about it. So there is a lot of backside when it goes to the testing. They are trying to avoid that due to this all the malfunctional things. But if you see, now, as you mentioned that you are trying to do something in terms of you are going to use saliva. Yes, you use saliva. You are going to create that kit. It will be something which will help them not to feel like surveillance. It will be more of acceptance, and it will give them the message. It's more of understanding and helping you. So when you go for blood test or urine test, it's look like someone is there is a cop around me and who is trying to keep surveillance or trying to get a investigation like I am a criminal. It makes more difficult for them to open up about it. Because it feels like something will happen to me, legal issues will happen. So they try to prevent. So if it is more of understanding that it will help them to just identify and help them to for relapse prevention, it will be more inclusive nature and it will be more empathetic towards that person. Okay. So currently we are developing a saliva-based biosensor, which is for detecting opioid non-invasive. From your counseling or clinical perspective, do you think where will be this most impactful during intake, relapse, prevention, or follow-up care? Okay. The basic thing I'll suggest, it should be first there in every clinic. Every clinic, rehabs, hospitals, and police stations. It is very mandatory.
because the thing is, when the person is there, it becomes very difficult to convince him first that you have to go for test. He has his rights and everything. And in that case, what happens? The person who is more abusing about it, he if we give him some time, what happens in our legal setting? What happens if you are not detectable? You are not a victim. You are not a this thing. You are not a offensive about it, right? So till that time, he has a liberty to roam around, right? So what happens at that time? It becomes very difficult for the society. Well, when they are into the abuse state, they'll do some mischievous things that can harm the society. So that's why in clinic and police stations and rehabs, it's very important for early detection. It will give us a quick result. At least it will create some primary investigation for the specialized person or the clinicians or the legal people that will help them to intervene and take the what you can say provisional actions for that, so we can avoid all the hassles after that.
Okay. And if we are deeply involved in counseling, what would you keep in mind if we were developing a product to make it actually helpful and empathetic towards the user?
So I think your product, what you have trying to develop, the device which will help them to just detect it from saliva, which is non-invasive, right? So it is more useful because I feel that is more empathetic, that is more of comforting and not like as I mentioned surveillance, which will help the person to just be accessible about it, have don't have stigma about it. He'll feel that it's okay to just do a test and get to know about self. It can make like we can break that thing that it is just a testing which will not have legal complications all the time. It will not something which will be challenging to you. It's just a test which will help you to get your own diagnosis. That are you really comfortable? Are you really doing well? Are you really dependent on that product? So that will give us a basic early intervention strategy. I feel that.
So, what do you think? Do people try to fake tests when you are given such a scenario in a rehabilitation center or a clinical setting like this?
See, we are humans, right? We know how to get out of all the things, right? So it is always a challenge. There will be a lot of if you develop something, there are always a loopholes. There are always a technique to just get out of it. But if you see, as you mentioned, it is something which will give us a quick result. When there is a quick result, it becomes easier to just it's difficult to manipulate it, right? And we can do it multiple times, right? If the something you feel like this is manipulated, I have to, if you do it by blood or urine, you have to take 5-10 days and after that understand this. But here it's a quick result. If you see that there is manipulation, you can just do a retest again. So it will be very feasible and manipulation is a part of life, right?
Exactly. So, if this product is widely available, do you think it would change the way India deals with opioid rehabilitation and the stigma in the next few years?
Yes. So I'll say that it's not you're just making it very constrained. I'll say not for India, it can be for world, which will help us to help everyone who is into the addiction, who is into the opioid addiction, especially. That will create a awareness about it. There will be acceptance. There will be relapse prevention. There will be some intervention technique which will be powerful, which will be immediate, which will be more effective, which will be pocket friendly, right? Because it is immediate, so it will come as a kit, right? So I think that this is very I have researched about it. So I think there are very few people who are doing saliva testing right now on this, and this will be something like benchmark where it will create a lot of insight about addiction, and it will be helpful for the people.
And what are the economic burdens the countries are facing, societal pressures that are going on with the stigma?
See, I'll say the thing is, I'll say economic burden, I'll make it more refined to it. I'll say that there is no intervention as such right now. If you see people who are addicted, we are not trying to just understand them, right? We are just into in the Indian setting, what I'm saying right now. We are just you are doing this thing, stop it, don't do it. But how to help him? No one is aware about it. So here comes the role of a counselor or addiction counselor, where we try to understand about him, what exactly he's facing. We think that he has done something, he is wrong, but the scenario behind it, why it happened, we have to understand. Ki, वो इंसान ये चीज क्यों कर रहा है, why is doing all these things? It's because of due to some emotional issues, family issues, financial issues. So we have to understand his setting, his mindset, and then help him out about all these things. If we do that, might be the economic burden in investing these products like drugs and everything will reduce. But it can be used to relapse prevention. It can be used for treatments. It can be used for other things. It will get channelized to a healthy way.
So, in a scenario where a child is facing such an addiction, how much burden a parent is facing, and how are they helping deal with it, and are they isolating themselves as well? Are there scenarios like that?
It is a very important question because the we say that if someone is there who is having addiction in the family, it's not only him, it's the entire family is suffering about this. So what happens in addiction, if you see, the person is into him, right? He's suffering by himself and he's not aware. He's feeling that I'm doing fine in my life. I'm doing very good. After addiction, my life has become very good. But the outer scenario, what we are able to see that he is not socially doing okay. He's not doing personally okay. His health is deteriorated. His family dynamics are deteriorated. So it is creating a lot of impact, which we are able to see as a third person, as a family members. So it creates a lot of stress, emotional breakdowns, a lot of economic burdens because the person with addiction tries to steal, tries to rob, tries to do such things which will create legal implications which they have to settle, right? So it creates a lot of purpose for them. So it creates an economic burden, it creates a emotional burden, it creates a personal burden to everyone in the family because of this.
Okay, and what about the police and the narcotics bureaus who are trying to help these and intervening?
Yes, they are trying their best from their end to identify and sabotage such elements in the society who is trying to supply all this kind of drugs or the substances. But it's very difficult because if you see, there are always loopholes in this where they try to find escape and just do it. But the thing is, they have to be more strict with their policies, what I feel right now. The policies are there, but I guess it's not so considerate like the other countries. But I feel that we are lucky that at least we consider addiction as a wrong thing or something which is not okay in our society. Uh, if you see outside in the countries, they are legal in some concentrations. But I feel that in India, what we are having the cultural bias about it, it's a good thing that we are trying to not promote the addiction, and it should happen. But yes, legal aspect, I'll say that police and the bureau can work more on this. They can instruct the people who are more into the drug dealing, and they can help run camps, more of insightful camps regarding addiction prevention and relapses, I feel.
And what about hospitals, point of care? If someone is consuming the opioid and they come into the ER, the emergency room, how helpful would the doctors and would be?
See what happens now. I was working as a HOD in one of the hospitals, and I was dealing with all these cases. So in hospitals, what I feel the lacuna here is the doctors are not trained to handle addiction. They know what the medications or the primary care to give, but apart from that, if the person is violent, if the person is aggressive, or he's having the withdrawals, they are not so well trained about it, or they might be trained, but it's not the cup of tea for them due to the patients are not usually get admitted to the hospital. They are mainly treated by their family members or their friends. So they should be trained more about this thing, understanding the addiction, how to have the relapse prevention, how to treat withdrawals, and how to create awareness because healthcare system is the primary caregiver. So if they are aware about it, if they can give insights to parents or all the patient and their family, it can be a game changer for us.
So while we are doing our technology, what are the ethical considerations that an researcher should keep in mind while they're developing the system and especially used in a sensitive population?
See what happens. The first thing is if you feel that it's about trust. Addiction comes with a lot of trust. When some patient or client comes to us, the first thing is he'll say that sir, आप किसी के साथ discuss तो नहीं करोगे. You are not going to put us in a legal state right now. So then only I can open up about it. So we have to give them the confidence about it that yes, we are there to help you and not to put you in some trouble. So we have to take their trust. We have to create an empathy and a secured environment for her or him where they want to work on themselves right now. If they're feeling that I don't want to get into the mess, then we have to give them the assurance about it. Then they'll come for the treatment. It's more about we see the addicts to get into the legal adherence instead of helping them to come out of it. It's more of surveillance and it's not more of empathy here. So if there is empathy, there is trust, there is confidentiality, and there is a right attitude to help them, it can make a lot of difference for them. Okay, and how well could this be used in proactively in high risk groups, or like might create or will it create anxiety or mistrust if not handled properly? Yes. So here that's what we have to psychoeducate them, why it is necessary to understand about it, why this product or why this system is very important to you. See, if you go to some addict and if you ask why this happened to me, he'll tell his all the story, why I started, what was the reason, and why he wants to get out of this. There is no person who don't want to get out. They feel like I want to get out of this, but they need the right help. So if you convince them that this is for your relapse prevention, your adherence, understanding the compliance, they'll surely understand about it. So now lately, one in every five teenager is using and getting addicted to opioids on drugs. So how should the universities, schools do take initiative? And what is more dangerous, peer pressure or drugs? I'll say peer pressure and drugs are the most concerning thing right now. It's both the things going hand in hand. The thing is, if you see the role of universities or the institutions, what I feel is they have to understand that this is the age where children are going to get distracted, youngsters are going to get distracted, to guide them in the right way. The guide them in the right way, like utilizing their energy in the right manner. If you see, the children are more into the pressure of academics. They are more into the thing that I have to perform. It creates a lot of anxiety for them, a lot of pressure for them. So if you try to make that pressure into something which will be enhancing their happiness, quality of life, their interest about it, they don't need a different kick in their life. They'll have this thing which will be like a high for them. If they are more into, if you see like MIT has arranged a hackathon, which was a wonderful thing where people like you who are more engrossed in innovation, you are engrossed in things which will help the society. It's more of entrepreneurship that gives you different kind of addiction which will help you. It will be healthy addiction, which will help you to grow as an individual. It will help you into the society. It will help you in terms of your career, your economics. Every dynamics will change. So replace your addiction with a healthy addiction. That's right. And an open platform now. What would you like to suggest from your end? Anything you like to say? Uh, I'll now you guys are like you're working into this project or your students right now. So my request to you all will be like it's very important to focus on your mental health. When you are physically fit, it's not on your competence, but when you are mentally fit, it comes to your competence that you are capable enough of doing a lot of things. So I suggest focusing on your mental health is very important, very crucial. So if you stick to this particular topic also, if you see, it's more of emotional support, it's more of care, it's more of career. So if you have the sanity around it in your mind, in your body, in your surrounding, it helps you to grow very nicely, and it grooms you very good. So I feel that if you have to take a message here, I'll say keep your mental health at the best. It will change all the scenarios in your life. Thank you, sir. So we now witnessed how drug addiction could be a major cause of problems in everyone's life, not only us, but the person who's consuming and people around them. And thank you very much for your time to educate and enlighten us about such scenarios. Thank you so much for Thank you. Thank you.